Well, Dr. Samuels, in your office, are you doing also? I know you're seeing lots of children because you have a pediatric dentist there, children doctor. Are you also doing orthodontic work?
As a matter of fact, we are. We're not doing comprehensive orthodontics that adolescents usually have. What we are doing is we're doing two different types of ortho. We're doing Invisalign, which a lot of people have heard about, putting little plastic covers over the teeth. That's one area that we're doing. And then we're doing something.
Let me ask you something about Invisalign. Are they really invisible? Are they really invisible?
In conversation distance, they're barely noticeable. Let me put it that way.
Well, that's great.
Yeah.
Okay.
Yeah, because they're very. Yeah, no problem. So that's one area that we're working with. Another area, and this is what I'm most excited about, something called 6-month smiles. It's real braces, real brackets, real wires, real bands. They're clear in tooth color, so they're barely noticeable. But the thing that's amazing about them is that literally in 6 months we can move your teeth and then take them off, and then you're set. As opposed to
but that's not good. You're not getting your money's worth. You're supposed to wear them 2 years. I mean,
well, that's exactly right. That's exactly right. You're supposed to wear ugly metal braces for 2 years, and something's not right here. Well, that's the difference between this and comprehensive ortho. I'm not putting down comprehensive orthodontics because there's certainly a use for comprehensive ortho in children and also in some adults. Mm-hmm. What comprehensive ortho is, it's complete orthodontics where the end result is a perfect bite. So you're changing everything. You're making beautiful aesthetics, and you're making a perfect bite. The thing with short-term orthodontics, which is what 6-month smiles is, we're dealing with adults who've had a bite that's worked for their whole lives. And we don't want to change that bite, and they don't care about having that bite changed. What they want is they want that beautiful smile. So all we worry about are 10 teeth on top, 10 teeth on the bottom, getting them perfectly straight, and leaving the back teeth to chew just the way they always did. And in doing this, we're able to move the teeth in such a quick manner where the bite is not altered, but the teeth look beautiful. We take them out, and just like in traditional comprehensive orthodontics, we then put on metal wires, fixed retainers, or we make removable retainers. And as long as these are retained, the teeth will stay where they are. And it's fabulous. I just cannot state enough how much our patients love this. And I still can't believe it. Sometimes, some cases, even a month later, it looks like you've had 80% of the movement within 1 month. I've had one case where I predicted it would be a 6-month case. Mm-hmm. We took off the brackets after 3 months. So the longest case so far has been 8 months. But I would say the average at this point is 5 or 6 months.
Wow.
And it's just fabulous. It really is.
And in terms of the braces, I know there is things out there called, clear braces, which basically the wires or the little things you put on, that they're very little visible or they go in the back. So these particular braces, are they also aesthetically good looking, meaning one can show his face with it?
Well, they're not metal braces, and it's not Invisalign. If you absolutely don't want to wear braces, then Invisalign's the best alternative for you. However, because they're tooth-colored and clear, it's really not that noticeable. If you're at the conversation distance, someone will probably notice something. But
I got it.
But that's about it. Yeah.
Right. And 6 months, I mean, that's compared to flapping on 10 veneers, which probably costs $10,000 and more, or whatever, or much more maybe. Plus grinds the teeth down and all stuff. That looks like a good alternative, right? This
is absolutely a great alternative for some people who wanted veneers, and now if they have perfect teeth, we don't need to put veneers on. We can just put these perfect teeth in the perfect place.
Your dog doesn't need veneers or braces. I think he needs a mouth guard. What do you think? He's coming home. Wonderful. Well,
that's right.
Well, wonderful. That's great. That's great. So that's so basically you do those braces, and you also do Invisalign. We're going to talk a little bit about Invisalign in another video because they have their own beauty, one might say. Thanks a lot.
That's right.
Thanks a lot.